Hi, I'm the founder of Stroll, a company that helps people make better healthcare decisions. So today, I'd like to share with you a personal story. About 2 years ago, I had a wart on my elbow. I went to my primary care physician at PAMF, who sent me to a dermatologist who within 5 minutes had taken one look, frozen it off, and sent me on my way home. About a month later, I got a bill. That bill was for $512. Since I was on a high deductible plan, I paid $512 at an hourly rate that's $6,000 an hour, which is a quarter of the cost of spaceflight on SpaceX. So clearly I was shocked at the price and upset that I wasn't given a choice, and I am not alone. By the end of this year, nearly 1/2 of all Americans that are insured will be on high deductible plans, and together we'll pay more than a quarter of all medical expenses. Had we known that we had a choice, we could have received the same high quality of care for a fraction of the cost. You might think that simply giving patients this information at home would solve this problem, but you'd be wrong. Fewer than 2% of patients that have access to cost transparency solutions use them. And the only way to solve this problem is to do it in the doctor's office, and that's exactly what we do. We help doctors achieve the triple aim of reducing the cost of care, improving outcomes, and improving the patient experience, while at the same time taking a process that used to involve paper referral forms, fax machines, and hours on the phone, and make it happen with a few clicks of our app. I'm happy to say that after nearly 2 years of collaboration with some of the nation's leading healthcare economists, researchers, and physicians, Stroll is releasing its beta pilot in the Bay Area for advanced imaging later this quarter. The market for advanced imaging is quite large. When you think about how Stroll extends to ambulatory care services, prescription meds, labs, and so much more, you can quickly see how big Stroll will become. For the last 50 years, managed care has tried to take top-down approaches to control patient behavior and reduce the cost of care through things like HMOs, networks, and most recently, accountable care organizations. But never before has it been clinically or technologically possible to go from the bottom up and help patients and physicians do the right thing the first time. So the next time you're with your doctor and you're worried about the cost of care or whether something is covered by your insurance, remember Stroll and know that confidently choosing affordable health care will be as easy as a stroll. Hey, thanks so much.
Great. All right, let's start with Mike. You got cut off.
Thanks. That was a nice presentation.
Thanks, Mike.
Can you talk to me a little bit about what the user experience is like, right? If I'm an average person and I want to find a way to reduce my personal costs, talk to me about how your application works.
Yeah, absolutely. So if you're an average person, you don't want to be involved in healthcare, right? You just show up at your doctor's office. And so basically what we do is we know that. So we have either your doctor or your doctor's staff, like a nurse, whoever actually does the referral today, instead of doing the whole paper process that I described, you basically, when that doctor or nurse is making a recommendation for where to go for care, they just use our app instead. And it saves them time, and it saves you a hell of a lot of money.
Question.
Yeah.
So there is a lot of technology which is being used today in doctor's office.
That's
so
right.
So you are going, like the hypothesis is that this new app is going to sell directly to the doctors, and there's going to be an engagement between patient and doctors, which is going to sit on top of existing infrastructure which is available. So it's a doctor sell.
Doctors are the users? That's right.
Okay, and then based upon your pilots, what is that engagement level right now, both from doctor and a patient engagement level?
Yeah, so we can't share numbers yet. We're just releasing our beta. We have an alpha out, but that's kind of the point. Once we have numbers to share, then we can go raise our A.
Yeah.
Great. Jordan, I have two questions
Awesome.
for you.
Thanks, Sharon.
First is, how are you integrating with payers to get this real-time information to
Yeah.
the patients, knowing what plan they have and where they stand versus their deductible?
Yeah, so that's a great question, and that's one of the coolest things that we've done. So we actually got started by working with Blue Cross Blue Shield, but then we quickly realized that we have to work with every single payer and work with every single plan, and not only every single plan, but work with every single person within that plan to know what their deductible is, where they are in their copay, that sort of thing. So we actually, through a number of partnerships, we do exactly what a hospital does, basically when they check to see if you have insurance, but there's so much more that you can do, and so we're kind of harnessing that technology. And then at the same time, we've done some advanced statistical modeling to determine what that negotiated price is to infer what you would pay.
One more question. Do you have plans for a direct-to-consumer model as well?
There are many consumers, as I'm sure most of us here, right, who when a doctor says something, you would like to go back and consult, and so our beta release doesn't have a consumer model, but once we get funding, that is the next thing we'll build.
So given that the ultimate payer for this is the payer, hence the name of the payer.
That's correct.
And they're the ones who benefit the most by reducing the cost of care. Why focus on the physicians who could be shuttling you to his or her favorite golf buddy? Why are the physicians and not on the payer?
I mean, so what's really cool about this problem is there's a lot of data out there now, right? Castlight just went public, so there's a lot of studies that study how patients make decisions about where to go. And even if you look at Castlight's data for advanced imaging, for the people that actually go and get that imaging, fewer than 7% use the tool, which means that 93% of people with access to Castlight just blindly do whatever their doctor says, right? And so if you actually want this to be effective, then you have to do it in the doctor's office.
Great. Good.
Great. Hey, thanks so much, guys. Yeah.